Okay. We're going to give everyone a minute to join us for today's webinar. We're going to be discussing child care and access to child care here in Kentucky. I'm Travis Burton with the Kentucky Chamber, and I just want to welcome you. Thank you all for joining with us today. We're going to give it just another moment to allow everyone a chance to get into the webinar before we kick things off. So today's webinar is a part of the Restart Kentucky webinar series sponsored by the Kentucky Chamber of Commerce and KCTCS. Today we're going to be discussing access to child care in Kentucky, what the COVID-19 pandemic has done to child care, and what it's going to be like going forward. And we have a great group assembled. And to lead the discussion today, I'm going to go ahead and hand things over. First, before I do that, I do want to say, as a part of the series that we're doing, this is going to be on our Restart Kentucky page, which is kychamber.com/Restart Kentucky. And you can find this webinar and other webinars there. So this is being recorded and will be available for viewing later. And with that little housekeeping item, and I'm going to turn things over. We'll have about an hour. And so we're looking forward to the conversation, which will be led by Shannon Gilkey from KCTCS. Shannon?
Well, thanks, Travis, and just want to thank the Kentucky Chamber for taking the lead on helping the state really think about how we restart our workforce and our economy and all the other critical services that we need to function on a day-to-day basis. I think now more than ever we have a new appreciation, a renewed appreciation for things that we may have thought that just happened on our day. Course in economic development at the community and technical college system, and I invited just an excellent panel of experts here in the state of Kentucky and from the U.S. Chamber. And it is way more important that you hear from them today than it is from myself. But I'll tell you before I introduce them that as a parent of a 3-year-old and a 5-year-old, and thinking that I had my act together as my wife works in healthcare at one of our hospitals, when I was confronted with the fact that I was going to have to work from home and then also attempt at making sure that they're getting educated, that they're healthy, that they're eating right, that they're actually awakening for me as a parent and an educator to the notion that our children are our future, not to be too cheesy here, and that their development is one of the most critical things that we can focus on as a state. And then the second thing is, since I think about workforce and economic development on a day-to-day basis, it's also an impact to our workforce from a couple of different ways. Number one, that childcare is an important field that we supply talent to, but also when we don't have that critical piece of our workforce functioning, it can also, and I'm a good example of this, it can really hurt our productivity as employees trying to function. And then so I am thrilled and honored that I can listen in on conversation today. The panelists that I have with me today are number one, Bridget Murray from Henderson Community College, who's professor of early childhood development at Henderson Community College. Sarah Vanover, the director of the Division of Child Care for the Kentucky Cabinet of Health and Family Services. Bradley Stevenson, who's the executive director of Child Care Council for Kentucky. And then Julia Barfield, who is the senior manager of policy and programs for the United States Chamber Center in the Workforce, Center for Education in the Workforce, sorry. And just take a minute if you're there and welcome our esteemed panelists. And I'm going to dive right in as to our to listening. It looks like we're having a few audio receptions. I'm going to turn my camera off just to make sure it's my bandwidth for video. 1 second. And maybe that'll help us clear up any internet issues that we may have, which may be another Restart Kentucky issue from today is to see broadband access across the state because we're so reliant on it. But that's a different panel and a different set of experts. Today, we're going to focus on childcare. So for our panelists today, I'd like to start it off with just a general question to get everyone warmed up. And please, panelists, feel free to jump in. It's a round table, very informal format. But the first question for our group is how do you feel like that childcare has impacted Kentucky as a response, as we've all tried to respond to taking care of ourselves through the coronavirus?
Well, I can start off by saying that the childcare closures have had an impact on me, not only at work, but as a working parent. With school closures and after school programs closed, my husband and I are both at home trying to work. I'm working longer hours right now than I was beforehand because the work-life balance of working at home, there doesn't seem to be a cutoff. You know, when I go to the office, I leave at 4 or 4:30, but at home, the whole day seems to be work. And then at the same time, I'm dealing with temper tantrums and I'm dealing with the fact that my children now eat 12 times a day. And all this is going on, and it makes you appreciate childcare so much more, but it has an impact on whether or not we're doing our jobs. It makes me feel guilty for not doing my job 100%. It makes me feel guilty for not being a parent 100%. And I think we have families all over the state that are going through that right now, that are trying to work at home because they don't have childcare in school, and then they're trying to do their job and not feeling fully committed to it, or feeling fully committed to parenting. It's a really easy way to start feeling guilty all the way around as we've been in this circumstance for the past 2.5 months.
Yeah, I have older kids, so I don't have the same issues that Sarah has. We didn't use childcare because they're older. We used childcare when they were younger. But I can echo the same kind of things. It's just the work and the grind, just being in it, regardless whether you're in childcare or education or whatever it might be. It seems to be more work than ever before, just trying to keep up with everything. And Sarah used the word guilt. I think a lot of parents feel that. And I've tried to use the word grace, just to be graceful and gracious to yourself, because it's okay to take time for yourself. And you know, not that you don't worry about the kids, but it's a difficult time. It's very different. But for me, not using childcare, I certainly don't have the same issues as the working parent who needs childcare right now.
Right, thank you for that. I appreciate that from the panelists. But you know, the meat of the issue that I think is the second question, just to get us, is how do we reopen Kentucky? How do we reopen our child care center? So I would love on this question to hear from each of the panelists. And Julia from the chamber, please give us that insight that you're seeing from these discussions on the country as states think about how to safely navigate this critical issue. But what is our plan for opening child care facilities in Kentucky, or your advice towards that plan to reopen those for the.
So I'm happy to jump in and answer that question first. Thank you so much for having me, and I apologize that I'm not using video today. I got in a little bike accident over the weekend, so I figured I'll spare you. But I think one thing, I'll let the other panelists speak about Kentucky specifically, but something that this pandemic has really brought to light for so many people who were not in the childcare field before is that the majority of childcare that is given in this country is given by private businesses. They tend to be small businesses. They are predominantly women owned and women of color owned. And this is a crucial industry. It employs roughly 1.5 million people across this country, and it generates about $47.2 billion in revenue every year. So fun fact, that's more employees than the airline industry, and it's greater revenue than spectator sports. So this is not a small field, but it is a very complicated business to be in because it's a very labor-intensive business, and these are providers who are following licensing guidelines and ensuring the health and safety of children initially, and then on top of that, educating them with quality care. So one thing that I think is crucial in understanding how to reopen childcare businesses is knowing that before this pandemic, we had a shortage of childcare providers in pretty much every community across the country. The burden was pretty much falling on parents to pay for that care. And now we're having these small business owners, like many other small businesses across this country, really dealing with challenges of meeting the health and safety regulations, following social distancing guidelines, but also trying to run a business. And so in order to follow social distancing guidelines, many childcare centers in particular are going to be having to operate at lower capacity. And so I think when we think about the state plan, and then also, you know, to Bradley's point of extending grace to childcare providers, recognizing that they are trying to run a business and keep kids and families safe. And so they probably will be having to increase training and cleaning supplies, but also then saying, you know, we're welcoming back fewer children than we could pre-pandemic.
So thank you for that, Julie. Could one of the panelists facilities in the state?
This is Bridget Murray. Can I weigh in?
Absolutely.
All
Thanks,
right.
Bridget.
Well, I have to say that I am at the college level at this time, but I had a private childcare program for 25 years. So I kind of have that perspective, and we'll share a little bit of that because there were problems with childcare, like Julia was talking before this ever came along. So if you think about a typical day in childcare, the parents arrive with their child. Hopefully they go through some kind of a security system to get in, but then the children go in and they're happy to see their friends, the materials in the classroom, and be welcomed by their teacher. And I do say teacher, they are not babysitters. They are not daycare workers. They are not caring for days. They are caring for children. During that day, they are building brains. They're getting children ready for school. They're doing such an important job, and we have to value that. In 2018, the average wage in Kentucky for a childcare worker was $9.28. They have no medical insurance in most cases, no retirement funding. Many of them work a second job or they rely on public assistance, which is very sad for someone who's doing such an important job. When you look at it from the parents' perspective, they are trusting that program with the most important thing that they own. They expect them to be in a safe and healthy learning environment, and it doesn't come cheap. Childcare is expensive. In some cases, they could actually send their child to college cheaper than they can pay for childcare. And look at colleges. We have financial aid, we have scholarships, we have grants, we have all kinds of things to help them. From the director's perspective, this is a really difficult job. Finding and retaining qualified employees at this low wage is hard. And I teach the director's classes for the director's credential, and they have to do a job shadowing, and they have to do budgets. And so at the end of the class, I ask them to reflect on, you know, what they think about being a director. And a lot of them say, I don't think I want to do this. I don't think it's what I thought it was. So that passion only goes so far. You do have to be able to, you know, have some, make a living in it too. So when we think about them, when COVID came along, the impact on the children, you know, they don't understand. They don't know why they can't go see their friends and their teacher. And so that's going to be difficult going back in to get them to readjust. There's going to be a lot of issues that go on there. And of course, parents, if you've already said, you know, all of a sudden they have a real new appreciation for people that work in teaching and childcare. And then the teachers, I have students that work in programs, and they were really worried at first about their paycheck. They don't have a lot of money. They work in a very low wage job. But one thing that happened was that they ended up being eligible for unemployment. And sad to say, their unemployment checks are more than what they get doing the precious job that they do in their child care paycheck. And same way with directors, you know, this is their livelihood, and it's really, really hard of everything that's gone on. And now all the new regulations, when you're talking about reopening, that's going to just provide more challenges. And I do worry that at some point they will break and they'll just say, I'm not going to do it anymore. That will be very sad.
So with that, as a follow-up, what are some of the long-term impacts that the COVID-19 will have on providers?
This is Sarah. You know, we're looking at many different impacts, and you know, this isn't just Kentucky. I've talked to multiple states in the past few weeks, and we're seeing the same trends in almost every state. The off-ramp to close childcare for every state was really quick. You know, we had like a 3 or 4 day warning and everybody shut down. Or in some states, they left it up to the center, but if they could only serve essential employees, they still shut down very quickly. They went from full or almost full enrollment to nobody in the center in like a week and a half. The on-ramp to get back on for childcare is going to take us maybe up to a year, maybe longer, because enrollment is not just going to come back. Parents are still very skeptical about the safety of their children in a group childcare setting. Some are waiting. Some have already made summer plans because they didn't know when childcare was going to reopen. So they might have a sitter for the summer and then they want to come back in August. Others may be waiting until a vaccination is ready. And so we're going to see this gradual wind up of enrollment over the next year. But childcare programs can't survive on 33% enrollment, 45% enrollment. From what we see across the US, 85 to 100% enrollment is what it takes to run a center, because you're dealing with human capital. 80 or more percent of your funding goes directly to pay providers. And so to pay those teachers to be there, you've got to have a higher enrollment. In Kentucky right now, of course, I'll say this, we have 120 counties in Kentucky. 65 of those counties do not have the child care they need for the children who live there, and they're considered child care deserts. With the enrollment that we do have, we have approximately 165,000 slots for children throughout the state. The National Association for the Education of Young Children is anticipating anywhere from 25 to 40% of the centers throughout the U.S. to close during this time period because of low enrollment, because of additional costs and financial instability. And as much as I would love to be able to imagine that Kentucky won't be in the norm on that, we're already starting to see centers contact the Division of Child Care and Division of Regulated Child Care to tell us that they are going to close at this time. And we were very blessed to receive $67 million from the CARES Act this summer that we were able to pass out to centers throughout the state to pay their fixed expenses if they were closed. So we paid mortgages, bills, utilities, insurance premiums. A lot of staff, as Bridget said, were on unemployment. And so we kind of have been able to get them through the closure period between the unemployment and the CARES Act dollars. But now, starting with reopen and seeing what kind of re-enrollment they have, this is where the long-term impact is going to come in. And we need to see, you know, first of all, we have an aging population that works in early childhood. Many of the providers in the field are at that at-risk age group that it might be challenging for them to be exposed to COVID, whether or not they'll be able to come back immediately because of health reasons. And then just in general, like Bridget said, it's a low-wage earning job. It's a job full of passion, and our providers who work in this field love these children. The stories they're emailing me right now about the programs that they love and the children that they love are so amazing to read and so sad to read at the same time, because they're so scared of losing their business. And right now there's just so much fear for them because nobody has experienced this before. We don't know what to expect, and many of them may end up doing better than they think, but they're so afraid right now of what it's what the future is going to look like and what their enrollment is going to look like. If they have high enrollment and people want to come back, then they're scared of having to turn families away who were previously enrolled, because there is going to be some reduction of capacity in order to keep the CDC guidelines of having a maximum group size of 10 within all the classroom spaces. And it's this balancing act. You know, we obviously want to follow the CDC guidelines because we want to keep our children healthy and safe. There's no question about that. We have to do what is necessary to keep our staff and our children safe. But at the same time, can we support the program financially enough for it to stay open? And that's going to be a great balancing act over the next 12 months.
Yeah, and I think too, just to add to a couple things that Sarah said, first and foremost.
You know, the other night. Oh, sorry.
Oh, can I go ahead, Shannon?
Absolutely, please do.
I was just going to say, to add to a few things that Sarah said, the CARES Act funding that the division and the cabinet's been able to provide to providers throughout Kentucky certainly has helped them sustain through the pandemic, and is probably going to help most of them reopen. It's the long-term, how do we sustain that over time is the real question. And I think it's the big fear that right now providers, you look at, not sure when schools are starting back, and a lot of parents will need care or not, you know, depending on how schools start and when they start. So there's a lot of questions like that. But I do want to say, I think it's appropriate to the cabinet and Sarah's department, that funding that those providers have received has gone such a long way to ensure some capacity for reopening childcare. And kudos to them for doing that quickly and thoughtfully and getting the money distributed so efficiently to those providers. We hear from them all the time, and I know that they're very grateful for that funding to be able to reopen.
The other night in our household, my wife sneezed because of seasonal allergies, and my son said, "Mommy, get away from me. Mommy, where's your mask?" But he's 5. We did have a series of questions that are very practical in that kind of sense. How do you train a 1-year-old, a 2-year-old, a 3-year-old to practice social distancing as young as they are? How do you keep a 3-year-old apart from another 3-year-old? So can you talk to us a little bit about the practical day-to-day behaviors that are these age groups, particularly the ones that are just learning communication, may have to adapt to, and how do we train our child care providers to help them in this new world of trying to be healthy around one another?
Let me start by saying that social distancing with young children, with toddlers, it does not look the same as social distancing that adults. When we talk about healthy at work for adults and staying 6 feet apart, that's fabulous in the office workplace. But if you have been around a group of 18-month-olds before, you do not tell them to stay 6 feet away from you. That's not how this works. So the precautions for social distancing look much different, and even the CDCs reflect this. At nowhere in the CDC recommendations does it say to keep every child 6 feet apart, because it's not realistic. The things that look like social distancing is keeping that group size small and keeping the same children with each other every day. It's having as few visitors in the building as possible. It's making sure that activities like children riding on the bus, preschoolers, where they put them 3 seats into a seat, it's removing those kinds of things for the time being. But there is no way to tell a toddler that they can't have a hug. There's no way to tell a toddler they can't sit in your lap or they have to stay 6 feet away from each other. So there are other precautions that have to be put in place instead of that, because it's very unrealistic to think that we're going to keep all of our children separated during the day, even if they are in classrooms of 10. So we remove unnecessary visitors from the centers. We have parents drop off and pick up at a certain point so that not every parent travels to the classrooms back and forth. We keep those small group sizes, and we reduce the amount of staff that are with the children during the day so that we eliminate unnecessary staff switching back and forth. But you have to be realistic about what a young child can understand and what they can do. And if you're expecting them to stay 6 feet apart, then perhaps you haven't been around a room of young children before.
One thing that I think about is
Thank you for that.
and what happens with young children that are learning language that need to see the mouth of the caregiver. I would love to see, and I don't know how this will work, the clear shields that they would be able to have. I know those are much more expensive, but they would be good. I think of, getting in the mind of a child, and a clear mask could kind of make you look like a robot, and that would be a little bit cool. But if you put a mask on that covers your face, then you would be a robber. So I think just looking at the perspective through how they're going to view all this is really important.
Thank you for that. Well, thinking about our workforce for caregivers, obviously, Julia said from the national level it was a huge shortage, and Sarah, you mentioned that we have an aging population. There's already a serious shortage. We also have, over 600,000 Kentuckians that are furloughed or unemployed and are suffering even more than those of us who are fortunate enough to have our jobs and just trying to deal with being healthy at home with our children. How do we help those individuals interest and a passion for children and the skill set to work for our child care centers moving forward? And how can our education providers, particularly the community college, help upskill, retrain, retool folks that might be?
One of the things that's happening on the national level is that the National Association for the Education of Young Children is working really, really hard to make early childhood education a profession. And part of those requirements, because right now in Kentucky, if you're 18 breathing and get a clear TB and background check, you're good. You get 6 hours of orientation training and you can go in with into a child care program, which is not enough. As we know, the brain is developing at the most rapid rate during the first 5 years of life. So it is really, really important that we have good trained people that are in those positions working with children. So the profession is trying to work to develop that everyone would have some type of a credential that would be working with young children. It's kind of modeled after what happened with nursing. If you take the example of a CNA, the CNA, you have to have that credential before you can work in a nursing home or a hospital or anywhere, and that's like an entry-level position. So in my eyes, children are probably even more important than people in nursing homes, that we've got to have good training. And they're really pushing the Institute of Medicine Transforming the Workforce study that came out in 2016, I think it was. They recommended that everyone have a bachelor's degree that works in an early childhood classroom. We know that's not realistic, it should definitely be our goal, but that we've got to make some inroads and help people. And we have credentials within the state that could build up to that level. And so, I think that's part of it that we have to, and the goal with the Power to the Profession, and the website is powertotheprofession.org. If you look on that and see the process that they went through to design the qualifications for each of the levels, and we need to be working towards those. We have a Commonwealth credential in Kentucky, and that would be a really good start to have people earning that credential, because it's 60 clock hours, but it is available in the community college. It's available through other agencies, so that would be really good if we could start to build our workforce there. I'm not really, I know when welfare reform came about several years ago, many years ago, and they decided that was the way to just put people in working in childcare. Well, in the first place, it's not a living wage, and that doesn't really help people. And so the other piece with the Power to the Profession is that they are looking at the whole thing is that wages will go up, and they have a whole outline of all the different things that need to happen to get to the point that anybody working in the field is compensated at a level based on their credential. So if somebody had a bachelor's degree, but they wanted to work in a childcare program with infants and toddlers, then they would get a supplement that would make them equal in pay to someone that is a preschool teacher in public school. There actually are some states that's doing that now. They're awarding stipends. I know it's not going to be possible unless our federal government kicks in and offers. And then one of the other recommendations on there is for businesses to really get some buy-in, to be incentivized to buy into helping early childhood professionals.
One thing, if I can add to what Bridget said, is that from our perspective at the foundation, I mean, I'm not going to pretend like I am a childcare expert or in a childcare business, but one thing that we talk about a lot is there's some great research that has been done to show the community and societal impact of quality childcare. And policymakers, business leaders love to see, it's a great equation. I'm sure many of you know about it. It's called the Heckman equation. For every dollar invested, society can yield up to, anywhere from $7 to $16, depending on who you talk to, in savings from increased income, education rates, criminal activity decreased. And so the only thing that I would mention is that those results come from quality childcare. And I think that can be a challenging thing for people to understand who are outside of this field. But when we talk about the importance of early child education on a child's brain development and why it's so expensive, is because it does, to Bridget's point, come from adults who are very capable and equipped to understand child development and support our youngest learners so that then they enter the K-12 system with the strong foundation they need to be successful. So again, from our perspective, we just really want to emphasize that it comes from quality, because you can't get the outcomes that we all love to promote if it doesn't come from a quality program.
I too, if I could add, as it relates to professional development, I've said that staffing has been quite an issue for several years in childcare, not just Kentucky, but just across the board, as what everybody has said: low wages, no benefits, long hours, stressful jobs, kids puking on you, whatever it might be. It's a really difficult job. So staffing has been gradually getting worse and worse and worse in order to attract and retain staff in the business. And really low wages pushes most of that, because you can go anywhere else, literally, and make more money than you do in childcare. What I have seen over the years I've been in the business is when you have a strong director at the center level, it really, really, really helps in terms of being able to recruit and then mentor and coach and train those staff in a way that is high quality, it's relationship based, and those staff tend to stay longer than the centers where directors come and go. So I've pushed for a while that, directors, when you buy in at the director level, you see that across your entire program, and you can walk into a facility and immediately know whether the director's bought in to it or not. But staffing was an issue before, and it's certainly going to be an issue moving forward from all the reasons before. And then in the short term, you add on the unemployment payments and those things that are taking place right now. It's going to be a real problem in the start rev up process here over the next couple of months.
Now, as Bridget mentioned, there are going to be additional requirements for staffing right now, predominantly just additional health and safety requirements as we go back, because we don't really know what to expect going back to group child care. During the time that the centers were mandated to be closed, we had a group of almost 80 centers that were open statewide. called limited duration centers that were emergency care. And they were open and followed some altered guidelines. Many of them had additional precautions in place, and we were successful with those programs. There were no children diagnosed in those programs or staff members diagnosed with COVID-19 during those programs. There were some family members of children, primarily because they were mostly hospital children that were in those programs, so the families were more at risk. And we have looked at some of those CDC guidelines for those programs as we look towards opening back up and what kind of precautions need to be in place. There will be a new training that is mandated for everyone to take prior to going back into the centers, even employees that have been in the field 30 years. There will be a refresher course on health and safety, predominantly cleaning and sanitizing and how to do the proper hand washing and some of those things. It's also going to contain some information about mandatory reporting. Child care programs in schools have been closed 9 to 10 weeks now, and child abuse reporting has dropped significantly. But we know that families are under much more stress right now than they've been under in a long time. And so, unfortunately, we know that that high level of stress can lead to abuse or neglect. And that is something that our child care providers need to be aware of too as centers open up. And so that basic training will be in place for everyone as they re-enter, and as new employees come in for the first 90 days, they'll have to take some of those new trainings as they get in place. But there's growth opportunity in the fact that if people do decide because of leaving another career field, if they transition to child care programs and look at what's going on, it is a growth opportunity right now to get them on a path towards learning more, to potentially get an entry-level credential and move in that direction. I started working in childcare at 19, and I started before I had a credential, but I moved up throughout the process to a doctorate level eventually because I developed a passion for the field and wanted to learn more and more. So we do have that that success rate that happens with our child care providers, but a lot of it has to do with funding too. You don't want to get a 4-year degree with student loans if you're not going to make a salary where you can make your loan payments. And so there's some balance there that has to take place.
Can I add one more thing about training? The social emotional impact that this is going to have on children, families, and staff. So I think moving forward, I was just talking to some of our trainers this morning, actually, the need to really focus on the social emotional piece of this and how to equip teachers to understand the social emotional part and why children are misbehaving, new discipline, guidance that's going to be required. But I think the social emotional impact is going to be far greater than the financial impact long term on our youngest kids and the businesses.
It's interesting. Sorry, Bridget, go ahead.
on one thing that Bradley said, he's so right about the director. And I will have to say that the Kentucky guidelines on directors is very low. Just 3 years experience and you can be a director. And so that I think probably should be bumped up. But he's so right. If you have an employee or a director and she supports an employee to go and get higher education, to like finish an associate degree, and then it's not long till that employee moves out of the private child care center into either a Head Start or public school where they can get benefits and a higher wage. And it's just very, very sad to see how much that director has invested in that employee, and the employee doesn't really want to leave, but it's in their best interest to do that. So kind of that pay equity issue comes in there again.
It's interesting. I want to flag the damage to social emotional intelligence that Bradley referred to. One of the key research projections about automation and artificial intelligence is the need for increased social and emotional intelligence for the future of work, and that's where there's solid research that shows us as we move to a more technological advanced world that we need to make sure our workforce has the capacity. Interesting is that's something that the lack of childcare at scale, quality childcare at scale will have on children. And it noted that for my notes. I do want to turn to a couple questions about how businesses can play a part. We our business, we have a lot of business partners, because of the Kentucky Chamber's investment in this type of dialogue, that are on the phone and that are out there, small, medium, and large, and they're dealing with a number of their challenges, just like our child care providers are for running their own business. Is how do you keep your doors open, to how do you restructure your workforce so you can reopen when the timing is right, to how do you deal with new occupational safety and health regulation, or guidelines, so you can be safe and not be a hotspot for the virus in Kentucky. But considering being sensitive to in large businesses facing their business side of how can they consider, or what should they consider in the childcare arena to help both their employees come back to work so they can start their services and product delivery back up, to how they can help their communities navigate this time.
One model that we've endorsed a lot this year, and we have some staff partnering with advocacy agencies throughout the state to look at, is a network model with an employer reaching out and kind of partnering with multiple centers in their area, and not necessarily paying them money even per se, which obviously they would love, I'm sure, if you wanted to help offset the cost of childcare, but even trying to just set up a network where an employer will find 3 or 4 high quality programs, endorse those programs with their staff members, say, they're going to make it a priority to place you first over other families because of our partnership. That in turn helps to get enrollment up in those centers so that they can function with the revenue that they need to come in. And that network model really kind of helps support everybody. As a parent, I have left work before because I worried about my child in childcare. And if I know that they're someplace safe, I'm going to stay at work and be happier. The employer knows that their employee is going to show up. The child care program is going to have higher enrollment and therefore be much more stable financially and be able to sustain long term. And that network model is a great model to have. There are other models, of course, large businesses like some of our hospitals throughout the state, the Baptist Health, St. Joseph in Louisville, where they have a child care program on site that is run by the organization, and then it fields just employees through their organization. Or we have companies like Bright Horizons, which is an outside company that partners with a large business, like at the Toyota Child Development Center, where they run the child care program on site. Toyota pays for the building itself, and they pay a fee to reduce the cost. So there are multiple models that you can utilize as a partnership between employers and child care programs. But the network is also a good model where as much money doesn't go back and forth when an employer might not have it, but still just having top priority for referral for slots for their employees, and then the center being able to reach that necessary enrollment to stay open. That can be a huge way to partner together.
And Sarah, who's the best position to organize those networks?
We have regional training centers throughout the state that know a lot of those, like Bradley's organization in Lexington, Corey Kadansky, who works with Community Coordinated Childcare in Louisville. There are agencies throughout the state who know all the childcare providers in their area, and they can help make recommendations for partners that might want to. Also at the Division of Child Care right now, we are working specifically with a project for infant toddler care. Jessica Kane is our staff member that is helping to set up infant toddler networks of in-home care with businesses. And she's done a lot of work on that through a grant that we received from the Kellogg Foundation. So there are different pilots throughout the state that are helping her to work with that in all different regions. So there's a couple of different contacts that you could reach out to, but those networks really can be a productive way for both the child care provider and the employer to benefit.
Yeah, I would love to build on what Sarah said and agree with all of your points, Sarah. It sounds like you guys have been doing some awesome things in Kentucky, and I'm really impressed. So this is something we talk about with employers all the time, and pre-COVID, this was an issue, and post-COVID, I would say every chamber I talk to says that childcare is a top 5 issue for them. So I think it's, we didn't want or ask for a global pandemic to cause this to be an issue that rises to the top. But I do think it's a great opportunity for employers to recognize the needs of their workforce. And so to Sarah's points, we have worked really hard to lift up stories where employers have made investments. And so we have a whole bunch of case studies on our website. I'd be happy to share those with Travis, to see that for every employer, the answer is not the same, right? So if you are a large business, on-site care might work for you. It also might not work for you depending on the size of your campus, your level of investment, your industry. And so to Sarah's point, the biggest thing that I would say to any employer is that we are not asking you to get into the business of childcare. I think, all the other panelists are great evidence that we have an incredible field of childcare experts, and that resources that you can tap into. And I think we would love from the foundation side to see more chambers and employers connecting with the childcare communities that already exist. I think we've talked about it's a very disjointed system at times. It's often underfunded, under-resourced, but it is a system and it has existed for a long time. And so I would encourage any employers who are trying to figure out, this is not in your wheelhouse and it doesn't need to be, because you need to be able to do your job well and figure out how to recover, and accessing childcare is one of them. For any employer who is thinking about what their options may be, a pretty easy first step is to understand the needs of your workforce. So I have encouraged all employers that I have spoken to. I've got a very short survey that we actually did internally as well to understand the differences of childcare needs for our employees pre-COVID and how they've changed post-COVID. So for someone to understand, were you at a center? Were you in a family childcare home? Did you have extended family caring for your kids? So that informs how our staff plan looks. So, for some folks who can't get back into a center because of, one reason or another, they might be in our third wave of people who can go back to work. And that's a way for us as an employer to acknowledge the needs of our employees. Now, I also recognize that we are in a privileged position, that we are able to work remotely. And this is something that we are doing. And I know that that's not everyone's case, but at least for our leadership perspective, it's really helped to acknowledge what our working parents need and what they're asking for as far as supports, because you may be surprised to find out what they're asking for. And before COVID, we actually did several economic impact reports on the cost of childcare breakdowns to the state economy. And in several states, we didn't do Kentucky, though we'd love to. But in several states, we found that the biggest ask that parents were seeking from their employers was flexible working hours. And so I think getting to understand what your employees need and then also what they want from you, it might not align, but there may be things that can be low-hanging fruit that you can do pretty quickly to ensure that, parents aren't making the tough decision to leave your workforce, and they may consider staying on board and saying, this is tough and we don't have it all figured out, but I know that my employer sees the needs that I have both at home and at work. So that's my 2 cents.
So we have about 10 minutes left. I'd love to go around the group to our 4 panelists and as final remarks, and ask you to help our state leaders start child care centers. And I'm going to challenge you, obviously, a lot of resources, a lot of dollars is an easy one, but I'm going to take that one off the table because we know there are tremendous gaps in the funding mechanisms that support childcare. But taking, just increased funding off the table, what's one recommendation that you would have for our state leaders and our small businesses and medium business, large business to help get everyone back to work and certainly reopen our childcare centers? And then part B to that question is there a resource or something that you could share to help direct folks to think about that recommendation? So I'm going to start with, because I know her so well now, from Henderson Community College, and then we'll go to Bradley, then Sarah, and then
Okay. One of the things, and back to kind of the business, and this is so simple, But I would just like for childcare, people that are working in childcare to be recognized as an essential workforce. And if that's just, I see all these discounts it's going to healthcare workers and policemen and all those things. If somehow they could just recognize childcare workers as being the important job that they do, I think that will go a long way, because they don't, you know, if it's just a discount on something or some kind of an incentive, I just think that would be a really good way to recognize them. There is, as Julia was talking about, the Heckman research, that is really, really amazing and very, very convincing if businesses are struggling on whether to invest or not. All of the resources that's on the Power to the Profession, which is powertotheprofession.org, really lays out a good progress, a way to make it to where we want to get to. And so I think that's really important. They do plan to go state by state and try to get some inroads and just look at where they're at and where they can go to start to make some big decisions. But somehow or another, we've got to recognize that the period of early childhood has to become a really important thing that our government and business and everybody gets on board and invests in. They're just too important. There's just too many things that make it just a no-brainer.
Thank you, Bridget. Bradley?
Yeah, I want to speak to the chamber just for a second, because I do think the chamber plays an absolute critical role from the business side of childcare. And we have struggled for years to get the business side to understand the importance of childcare to their workforce, to come and make whatever the widget is for the day, whatever that might be. And so I know the chamber for the past couple of years has been focusing on the importance of childcare, early care and education. And I want to challenge the chamber, and I'm doing this, I mean, you asked. So, you know, to really find a way to collectively pull all chambers in Kentucky together. This is not just a Kentucky chamber issue. It's not an Owensboro issue. It's not a Lexington. It's a whole state issue. And we have to get the business buy-in and financial support to make this work. The state does not have enough money to financially support everything that is necessary to raise wages, offer benefits, set up systems of these networks. And not that the chambers do either, but they do have, those businesses have to buy into childcare. And so I'm challenging the chamber, Travis, you specifically, no, I'm just kidding, let's continue to push and hammer for quality childcare so that parents can get to work and they know their kids are going to be safe. They're going to receive a high quality education every single day. And I think the chamber working across the state can really help us on the business side of that. I hope that was okay.
Thanks, Bradley. Sarah?
Well, you know, from my perspective, I'm not coming at asking or challenging the state to do certain things, since that's where I'm sitting right now. But I will say that I appreciate hearing our child care providers' voices. I've been a teacher, I've been a director. Right now, I'm a working parent who's having to pay into child care. And so I've seen the situation from multiple angles. Right now, my biggest concern is just making sure our child care providers know that there are resources out there for them. As we get ready to start back up, we have people that are waiting to assist. We have child care aware coaches throughout the state who want to help centers create their new cleaning plans. We have child care health consultants that are there to help you ask questions about, you know, what the health department recommends for closures, what the health department recommends for once exposure has happened in a center. My office is there ready to help with child care assistance payments. We're still finishing up sending out those CARES Act dollars and processing hundreds a day and trying to get those out to everybody. You know, there are a lot of resources out there, and many of our very high quality programs access those resources a lot, but I challenge all programs, no matter who you are, to ask for help. This is a time when we all need to help each other, and there are resources available to do that. And, you know, even myself, my office there, I'm answering directors' emails every day. And, you know, that's what we're here for during this time. So please make sure to reach out. Our regional training centers throughout the state are there. You know, there's a lot of resources that you have access to if you ask.
Thank you very much, Sarah. Julia?
Well, I think this is a great question. I'm glad that I went last because I had enough time to think about it. But it's a great question to end on and a tough one. I would say two things because I couldn't narrow it down to one. First, I would say for any business owner, we absolutely recognize that you are in an unprecedented time financially, making really tough decisions, probably with less information than you wish you had. And I would say that you can always do something in regards to supporting your working parents and their childcare needs. What that something is, I recognize is going to look very, very different depending on your context, your size, but I would challenge every business that they can do something, whether it's a survey, whether it's flexible working hours, whether it's paying into an employer pool, whether it's joining what Sarah mentioned of these staff networks. There is something that you can do, and I would challenge you to think through what makes sense for you financially, you know, whether it's now or in the future. And then for childcare providers, I see a lot of you in the chat, and I would say, you know, there are not enough childcare providers who not only don't see themselves, you know, they see themselves as teachers or as educators and not necessarily as business owners. And at the foundation, we would love to see more childcare providers join chambers. I have no financial interest in you joining a chamber, so that's not, you know, I'm not biased there, but we would love to see more childcare providers own the fact that you are part of the business community. And I think we are working hard to do more to include childcare businesses as a crucial sector, as a crucial industry. But I think we have seen a lot of great success when childcare businesses have felt like they are empowered to be part of the business community. They've joined forces with the business community and really partnered for success together. If you are a childcare business owner on this, I would encourage you to recognize that you're a business owner, and that's something that, you know, we want you to be very proud of. We love small business, and we want you to be successful and be able to survive this crisis.
Well, thank you, Julia, for that. And just want to thank all of our panelists today and all those that attended. We had a really great turnout. It was a lot of folks from around the state, and so all of our child care providers out there, as a fellow educator, just want to thank you for fighting the good fight on behalf of our children and the future of Kentucky.
Yeah, and this is Travis. I just want to add.
We'll include you, Julia, as a Kentuckian for today.
Thank you.
So this is Travis, and on behalf of the chamber, I want to thank you all. This was a great discussion. We certainly, it's going to be I know a difficult few weeks coming up, and we know that these conversations are very vital in making sure that as many of us can be successful going forward as possible in the childcare world, and it's such a vital component of the workforce. So thank you all, and we appreciate all of the panel. They're excellent partners to work with, and we want to continue to do that as we move into the next few weeks. Please visit kychamber.com/restartkentucky for more information about webinars, previous webinars. We'd love for you to check those out. A lot of good content there. Again, thank you to our panelists. Thank you for being here today and for all that you are doing for Kentucky. And with that, we'll go ahead and close out this webinar. Thanks again, and have a great afternoon.